You're crouching beside a dying member of your tribe, 5,000 years ago. They're burning with fever. Their skin is covered in angry red welts, and their breath comes in shallow, rasping gasps. There are no hospitals, no antibiotics, no doctors. Every person in your group knows this could happen to any of them tomorrow. Disease has been humanity's deadliest enemy since long before recorded history. It's killed more humans than wars, predators, and natural disasters combined. But here's what's truly remarkable. Our ancestors didn't just passively accept death by disease, they fought back. And the ways they did it, from brain surgery to herbal medicine, are nothing short of astonishing. Let's start with one of the most shocking medical procedures in human history, trepanation, drilling a hole in a living person's skull. This isn't science fiction. It's one of the oldest surgical procedures known to archaeology, with evidence dating back at least 7,000 years. And the really mind-blowing part? Many patients survived. At a Neolithic burial site in France, archaeologists found skulls with perfectly round holes cut through the bone. The edges of the holes showed clear signs of healing, meaning the bone had begun to regrow after the surgery. This proves the patients lived for months or even years after having their skulls opened. In some cases, multiple trepanations were performed on the same individual, suggesting the procedure was considered effective enough to repeat. Why would anyone do this? The most widely accepted theory is that trepanation was used to treat head injuries, particularly skull fractures from combat or accidents. By removing fragments of broken bone that were pressing into the brain, early surgeons could relieve dangerous pressure. Some researchers also believe trepanation may have been used to treat chronic headaches, seizures, or mental illness, essentially to release evil spirits that were thought to cause disease. The survival rates are genuinely impressive. A study of over 800 prehistoric trepanned skulls from Peru, where the practice was particularly common, showed that survival rates improved dramatically over time. Early trepanations from about 400 BCE had survival rates of around 40%. By 1000 CE, the success rate had risen to over 80%. These ancient surgeons were learning, improving, and passing their knowledge down through generations. But disease treatment started long before surgery. Evidence suggests that even our non-human ancestors practiced basic medicine. Primatologists have observed chimpanzees deliberately seeking out and eating specific plants when they're sick, plants that have known antiparasitic and antimicrobial properties. At the Budongo forest in Uganda, researchers documented chimpanzees applying insects to open wounds, behavior that was described in a 2022 study published in Current Biology. If chimpanzees can self-medicate, it's almost certain that early humans did too. The evidence supports this. A 2012 study by Karen Hardy and colleagues, published in Naturwissenschaften, analyzed dental calculus from Neanderthal teeth found at El Cidrón Cave in Spain. The results showed that one individual, who had a dental abscess and likely a painful intestinal parasite, had been consuming poplar bark and chamomile. Poplar bark contains salicylic acid, the active ingredient in aspirin. Chamomile is a well-known anti-inflammatory. This Neanderthal wasn't randomly chewing on plants. They were self-medicating with natural painkillers at least 49,000 years ago. The oldest known medicinal kit was discovered at the Shanidar Cave in Iraq. There, Neanderthal burials dating to approximately 60,000 years ago were found surrounded by concentrations of plant pollen, including yarrow, cornflower, and groundsel, all plants with documented medicinal properties. Archaeologist Ralph Selecki originally interpreted this as evidence that Neanderthals buried their dead with medicinal flowers. While some researchers debate whether wind or animals deposited the pollen, the finding remains one of the most evocative pieces of evidence for early medical knowledge. Honey may be one of the oldest medicines known to humans. It has natural antibacterial properties and has been used to treat wounds across cultures for thousands of years. Modern medicine has confirmed that certain types of honey, particularly Manuka honey, are effective against antibiotic-resistant bacteria. While we can't know exactly when humans first discovered honey's healing properties, the oldest known depiction of honey harvesting is an 8,000-year-old rock painting in Spain, showing a figure climbing a ladder to reach a beehive. Ancient humans also understood the connection between cleanliness and health, even if they didn't understand germ theory. Archaeological evidence from multiple cultures shows the construction of drainage systems, waste disposal areas positioned away from living quarters, and designated water sources. The Indus Valley Civilization, dating to about 2600 BCE, had sophisticated sewage systems with covered drains running under streets. While this is relatively recent in the scope of human history, the basic principle, keeping waste away from living and eating areas, likely extends much further back. Bone setting is another ancient medical practice with deep roots. Healed bone fractures in prehistoric skeletons show that early humans knew how to align broken bones and immobilize them while they healed. Some of these healed fractures are remarkably well aligned, suggesting genuine skill and experience. A 2009 study published in the International Journal of Osteoarchaeology documented a Neanderthal skeleton from Shanidar with a healed fracture of the arm bone that showed evidence of being deliberately splinted. Amputation, another seemingly modern surgical procedure, turns out to be far older than anyone expected. In 2022, a groundbreaking study published in Nature described the discovery of a 31,000-year-old skeleton in Borneo with a cleanly amputated lower left leg. The bone had healed, and the individual had survived for years afterward. This pushed back the earliest known evidence of surgical amputation by nearly 24,000 years. The precision of the cut and the patient's survival suggest that the surgeons had sophisticated knowledge of anatomy, blood flow control, and wound care. Perhaps the most fascinating aspect of early human medicine is the evidence for psychological and spiritual healing practices. Shamanism, broadly defined as the use of ritual, altered states of consciousness, and spiritual practices to treat illness, appears to be one of the oldest forms of medical practice. Cave paintings from the Upper Paleolithic period, dating to between 40,000 and 10,000 years ago, depict figures that many researchers interpret as shamans, individuals in ritualistic poses or wearing animal costumes. While it's easy to dismiss spiritual healing as mere superstition, modern medicine has demonstrated that psychological factors play a significant role in health outcomes. The placebo effect, in which patients improve simply because they believe they're receiving treatment, is a well-documented medical phenomenon. In a community with strong spiritual beliefs, a shaman's rituals may have provided genuine psychological comfort, reducing stress and promoting healing in ways that would have been measurable, even if the mechanism was misunderstood. Disease wasn't just fought on an individual level. Some of the most devastating epidemics in human history left their mark long before written records. Analysis of ancient DNA has revealed that plague, caused by the bacterium Yersinia pestis, has been infecting humans for at least 5,000 years, far longer than the medieval Black Death. A 2018 study in Cell identified plague DNA in Neolithic and Bronze Age individuals across Eurasia, suggesting that large-scale epidemics may have contributed to major population collapses and migrations thousands of years before the first civilizations. The human immune system itself tells a story of ancient disease survival. Every human alive today carries genetic adaptations shaped by millions of years of pathogen warfare. The CCR5-delta32 mutation, which provides some resistance to HIV, appears to have been selected for during historical plague outbreaks. Our diverse HLA genes, which help the immune system recognize pathogens, represent an evolutionary arms race that has been ongoing for millions of years. What's the takeaway from all this? Modern medicine, with all its miracles, didn't appear out of nowhere. It's the culmination of a medical tradition that stretches back tens of thousands, possibly hundreds of thousands of years. Every pill you take, every surgery you undergo, every vaccine you receive, builds on knowledge that our ancestors began accumulating when they first noticed that chewing certain plants made pain go away, that keeping wounds clean helped them heal, and that drilling a hole in someone's skull could actually save their life. The history of medicine isn't a history of modern breakthroughs. It's a history of human determination to fight back against the oldest enemy of all.